you so much, John, for joining us today. AARP Indiana, obviously, since the world changed in March, has really been trying to take and make an effort to highlight some of our partners, especially those that we've had working relationships with over the last few years and months. And so Gleaners is one of our really critical partners in some of the work that we do around food access, especially healthy food access. Something that we've really been working to strive to sort of help promote and build a foundation for, both on at the State House and on a local level as well. And so I thought it would be a great idea for us to kind of talk together and join and hear from you, mostly about Gleaners and kind of how Gleaners is working now during this COVID crisis. And then also just for you to sort of help us highlight the importance of the work that you all doing at Gleaners. So, John, thank you so much for joining us. And can you tell us a little bit about Gleaners and the work that you all are doing there?
Gleaners was already a complex organization in that we have multiple roles pre-pandemic.
Yeah.
And then when you consider the fact that really every role in the organization changed, every program has changed, some programs have stopped, and entirely new programs had to be built on the fly. To talk about transformational change in crisis is an understatement.
Yeah.
Gleaners has 4 roles. We are a traditional food bank with 21 Indiana counties as a service area, and that includes Central Indiana, Eastern, and Southeast. So by nature of which counties that is, it's a third of Indiana's population. We also do natural disaster response for the Feeding America Network, one of about a dozen of the 200 food banks that does that. We are a contract reclamation site for Kroger stores in Indiana and Illinois. Surplus food and non-food comes in here by the truckload from Kroger distribution centers. So that's a contract relationship that also contributes a disproportionate amount of that food and non-food into our distribution area. So it's a positive thing for that role. The more recent role gets to your point on nutrition. Feeding America set up 6 new regional cooperatives focused first on gathering produce, the largest component of the 40% of U.S. food production that's wasted every year, and getting that into the hunger relief system. So Gleaners supports our sister food banks in 9 states in that produce co-op, and it's run as a subsidiary of Gleaners, the food bank. But Gleaners, the food bank, is also the largest customer of that co-op, meaning all of that fresh from the farm produce that now comes through here disproportionately benefits our service area and the other Indiana food banks, and then as you extend out. And to put it in context, before we launched that produce co-op in the spring of 2017, we got 0 pounds of fresh produce straight from a farm.
Okay.
It was retail surplus near the end of its life cycle that was gathered up by going from retailer to retailer and gathering their surplus. And it amounted to a lot in total, but it was 1 banana here or 3 apples there. And now we're getting single item semi-load quantities coming in here. And we will have, last year, 50% of the food we distributed. So in a 2-year period, we went from 0 to 50% of our food was fresh produce. Phenomenal growth. It would be the envy of a for-profit company, I think.
Yeah, no, that's truly amazing. I think one of the ways that we've also tried to sort of make sure that the nutritious side of our food work is happening is also partnering with local farms like Edna Martin and then Brandywine Creek Farm as well. So we understand the importance of, making sure folks have access to good, nutritious food. And so one of the things that we've all sort of been sort of talking about, and I think you mentioned it as well, was around sort of what's life like, post COVID, right? So I think one of the ways that we partnered with you all was that we would have our volunteer teams work at the older adults food distributions that you all did down at the center here on I believe it was like 3rd Monday of the month. And so I think some of that stopped for a while or has stopped completely. And then we've also make sure our volunteers were sheltering in place during that time. So can you talk a little bit more about how, you mentioned some programs that have been cut or changed, So can you talk a little bit more about how your work has changed now that sort of we're living in this COVID world?
So I heard program change and I heard workforce change in your questions. So maybe I'll split them into two answers.
Sure.
So pre-pandemic, 40% of the work done at Gleaners was done by volunteers.
Yep.
As the pandemic hit, very quickly we went to a less than 100% staffing model, as we had young parents who needed to stay at home with kids who weren't in school, and thankfully very little health impact. But we were running at 80% staffing for a while, and yet the workload doubled in volume and even more so in complexity as the pandemic hit. And we saw two significant surges of increase in need. The first was when schools closed. The second was when employers started laying off or reducing the income of employees. So big surge as kids were not in school, and we lost one of the largest sources of meals for the food insecure in the state. 19% of the meals for the food insecure in Indiana pre-pandemic were through the school meal program. 10% from everything Gleaners does.
Wow.
The scale is massive, and you can imagine what that did to our lines as schools closed.
Right.
But then there was a workforce impact also, not just losing volunteers that did 40% of the work and losing 1 out of 5 employees in terms of ability to come here and work on site, just as the work doubled. So you need 200% of the workforce, and all of a sudden you've got less than 40% of the workforce.
Yeah.
So we very quickly reached out to a temporary staffing agency who was having to let his employees either go or putting them on furlough because their work locations, like the convention center in downtown Indy and large hotels and so on, were stopping. So we were able to keep them getting a paycheck by picking up the pay for 45 to 50 temp workers. They stay on a payroll. They don't end up in the food line because they lost their household income. We also allowed them to have food boxes from Gleaners for their families, and they end up packing family meal boxes up to 30,000 a week. That was not a Gleaners program before the pandemic. It is a new built from scratch program. And the neat part of the story is who's packing them, who are they packing them for, and so on. And then the National Guard has been key. We've had, it's varied, but roughly 45 National Guard soldiers on site at Gleaners and going out to mobile food pantry distributions across the other 20 counties. So critical to success. Frankly, without the reliable staffing temp workers and without the National Guard, we would have been talking about how much would we reduce meal distribution, not talking about how we've been able to double it.
Yeah. Wow, that's amazing. And I think for us at AARP, we really felt, helpless for a while there about sort of how can we help and how can we, be a part of that, because I think we have a lot of our members who want to volunteer and be a part of, the work that you all are doing down there. And so I'm really glad to hear that not only was it just an opportunity for you all to rethink and reimagine what you all are doing, but also an opportunity to give folks work while they were out of work, so to speak, and then ramp up what you all were doing. And so just to transition off of that a little bit, can you talk a little bit more about what donations from, like our organizations like AARP Indiana and others have done to help during this time of COVID and post-COVID and pre-COVID and all of that good stuff?
Well, just like AARP, you know the clients that you serve and the population you're trying to help. And we've had opportunity to really study that and think about it as well. Not just those that were in the food line pre-pandemic, but those who've joined it since.
Right.
And thankfully, we had a relatively new strategic plan in place that put a lot of emphasis on the healthiest, most nutritious variety we could possibly serve, and what new ways, new channels, new capacity that we need to do that. But also flipping every measure or evaluation of success to a client-centric measure. What gets to the right client outcome, and being very mindful of who is that population in need. unfortunately, the youngest children and the oldest seniors are growing as a proportion of the population we serve pre-pandemic, and that's worse now.
Yeah.
So the population you serve is the most urgently, the one needing the most urgent attention because it's growing and it shouldn't be. And some of the choices that we're trying to resolve through the new strategic plan, like households choosing between food or medicine, food
Yeah.
or rent, food or paying utilities, that's even worse in that senior population. And it ties to crime. It ties to substance abuse. I mean, if you think about why are more and more grandparents and great grandparents raising their grandchildren
Right.
without the resources to do so and having to end up in a food line as part of that process, then those questions of food or medicine are worse.
Yeah.
Because they may feed their grandkids and not take their medication, which makes their health condition worse. But then the food they eat becomes part of the mix as well, because we all know the top 10 chronic health conditions in this country are impacted more by the food people eat or don't eat than household income or other factors. So if you start putting more and more people into that situation, you just exacerbate it.
Yeah.
Even if you think about it as a taxpayer,
Yeah.
those food insecure households in the state of Indiana are spending $1.1 billion a year additional on health care just because of food insecurity.
Right.
In addition to other healthcare costs. If we could capture a quarter of that and put it into food insecurity, we'd solve the whole thing overnight.
Yeah. No, and I think that was the message that we were, trying to portray as well with our work at the State House, is to say that solving folks' food insecurity, just like, housing and transportation, right? If we can make sure that some of those things are taken care of, the impact will be felt greater, and the return on that investment is much, much more impactful than anything else that we could do for folks. So I really appreciate you driving that point home for us. And then sort of as we close, we're going to put this, this conversation out onto our social media and share it with some of our members as well. But how can people help? How can people continue to serve and continue to help even in this time when folks are, kind of coming out? Indiana has started to sort of get back, trying to get back to normal or the new normal. But how can people help Gleaners and support the work that you all are doing?
During the period, we still have significant social distancing and other health-driven restrictions. As a result of the pandemic, we will not get back to full volunteer mode. And we've already taken some steps to change our processes so that we can get the same work done or more work done with less volunteers. Things like conveyor belts that are on order and some automation and things so that maybe you can pack a box with 3 volunteers instead of 12 or something. So, so there will be changes that become permanent before we bring volunteers in fully. So in the meantime, you can still go to gleaners.org/volunteer and get updates, as we very cautiously ramp that up, both on site and in rural counties. But also the need for cash donations is greater than ever.
Yeah.
You think about our largest single source of food, retail store donations, almost stopping you've seen the state of retail stores. It's chaos. My former employer, Kroger, is struggling just to keep their store inventory in some reasonable order. And we're competing with those retailers when we go out and buy food as food banks. So we went from buying 8.5% of our food pre-pandemic to buying more than 40% of the food now.
Wow.
And if you think about, that's exacerbated by us losing our traditional discount from food companies because they're trying to keep up with retail orders, and food, they're not going to sell it to food banks at half price if Kroger and Walmart and Aldi and so on need it.
Yeah.
So our food cost is 8 times what it was the same time last year, our weekly cost, because of loss of discounts and having to buy such a dramatically higher percentage of the food we distribute. So It may sound a little blunt, and I'm sorry, but cash contributions are critical right now.
Hey, I think really that's really what we want to try to drive home with these conversations is is to know that the work hasn't stopped, for one, and two, that the need has grown not only just from the everyday need that you all were already serving, but exponentially, right? It's also increased because of COVID and folks, losing jobs and folks not being able to work and even folks having to stay at home, right? Like, so how,
Right.
yeah, we want to make sure that, organizations like Gleaners are, able to share their story and then more importantly, help to drive and move the mission forward. So thank you so much, John, for spending a little bit of time with us today. If there's anything else you'd like to share, please feel free to do so. If not, we appreciate your time.
There's one other point I would make, if you don't mind.
Sure. Yeah.
You mentioned advocacy earlier.
Yes.
One of those points of view I think the general public is not aware enough about is the distinction between the medical recovery timeline for communities and the economic recovery timeline for communities.
Mm-hmm.
And social service charities like Gleaners are really focused on the economic recovery timeline. In other words, how long will what quantity of households be in those food insecure lines and need help?
Right.
And not just need food, but maybe help with income, housing, utilities, transportation, other things. And that is distinctly different from how long it will take those families, if affected, to recover from the pandemic itself and the medical implications.
Right.
That is, even though it seems like it's going on for an extended period of time, the medical recovery timeline will be shorter.
Yeah.
It's not a direct comparison, but if you look at the economic downturn in 2008, the peak number of food insecure households in this state hit in 2010.
Wow.
2 years after the start of that economic downturn. And it was 2014 before we got a handle on the food available catching up with the need.
Yeah.
So that was a 6-year extended cycle on the economic recovery. I'm not predicting it's 6 years this time. I honestly don't know, but I know that it is longer than the medical recovery timeline.
Right. Wow. So yeah, thanks. I mean, thank you for sharing that. I don't believe that was something that we had, thought about ourselves. And so as an advocacy organization, it's always important for us to sort of gather where the resource needs are and what people need to be thinking about. And so hopefully, as we move forward, that's something that we can also add to sort of our advocacy taglines and just also thinking about how long it will take for families to sort of get back to, I guess, whatever normal was pre-COVID. So
one thing too, if you have interest, we have just activated what many of us have wanted for a long time, and that's a nutrition hub on the Gleaners website.
Okay.
And so that, in fact, we're moving very quickly from English to adding Spanish, and we'll do additional languages as well with help from cultural organizations like the International Center and Immigrant Welcome Center and so on, the Burmese Association. We want to keep adding language capacity, but our 2 registered dietitians on staff have led that effort and worked with County Extension Service and State Health Department and County Health Department and others to get food safety, nutrition, meal prep, recognition of produce maybe they haven't seen before. There's a whole variety of things in there. And for us, it's not just, it's no longer enough to throw some food in a box and hand it out.
Right. Yeah.
You have to be part of an education process as well.
Outside of obviously all of us, staying at home and being home, home and staying safe and that kind of thing. But folks, we talked earlier about sort of housing and all of this other stuff. But a big piece of also, food is accessing the food, right? So how do I get to the grocery store and all of those good stuff, especially for older adults who are encouraged even as we open back up to try to stay at home as much as possible. Is there any conversations or any programs that you all are doing to help folks who may be at home and be able to get food from their home or get to you all from their home?
Well, we're constantly looking for ways to improve access to food for clients we serve in any program. But one of the new programs we built in response to the pandemic, and initially thinking primarily about those who were COVID positive and quarantined at home, although it ended up being very beneficial to senior citizens and others that have trouble getting out
Yeah.
on their own and accessing food, is a home delivery model. And we relied on two of our Gleaners vendors, Carano and Genesis, to design literally over a weekend a call center model where you can call in or text in to Gleaners if you need food delivered to your residence. And then Indie Hunger Network staff take those calls and messages and turn those into delivery lists. And 913 Sports, a fellow nonprofit based here in Marion County,
Yep.
we deliver food to them in bulk, and it's family meal boxes with a variety of food as well as produce boxes, and they take care of the actual delivery of those. Later on, we realized some people didn't have the capacity to prepare the food,
Mm-hmm.
so we brought in second helpings, and they've added prepared meals into the mix. So when you call in, they'll ask, can you make your own meals or not? And that decides whether you get food from Gleaners or meals from second helpings. It's running about 1,000 or 1,000 plus households a month in Marion County. And we feel it's done a great job of getting people who are disproportionately in need, getting them served. And we plan to continue that after the pandemic. We're working on funding and support for that to keep that going. It's been funded by the United Way led funder consortium and the city of Indianapolis through the summer. But starting September, we got to figure out how we're going to make it keep working.
Right. Okay. Yeah. And on that note, let's just remind people again where they can go to obviously donate, and then also learn about the great, food programs that you all are running and the nutrition and all that good stuff that we've talked about today.
So gleaners.org would be your destination for donating, checking volunteer opportunities, to go to the nutrition hub that I talked about, as well as finding information on the home delivery program.
All right, great. Thank you. And then for those of you obviously wanted to stay in touch with us at AARP, please feel free to visit www.aarp.org/in. And all of that hub will also have all the information that we have about coronavirus, how to stay safe at home, and then any other activities that we have as well. So that's aarp.org/in for information on the happenings in AARP Indiana world, and then aarp.org/coronavirus to get more information about the coronavirus itself and what resources AARP has to help you to stay safe. So thank you again, John, for joining us, and really appreciate the time.